Welcome to the Vet Dental Show. I'm Brett Beckman, and in this episode, we're going to be interviewing Dr. Brian Song. Brian is an MD with a background in human biopharmaceuticals, and he's the founder and CEO of PerioVive. And PerioVive is the veterinary equivalent of hyaluronic acid that's used for regenerative periodontal applications. This interview went a bit long for our format, and thankfully, because there's a huge amount of information in here for the general practice. So we're going to have the first segment today, and then next week we'll follow up with the second segment. So sit back and enjoy this interview with Dr. Brian Song. So Brian, welcome to the Vet Dental Show. Would you please give the audience a little insight into your educational background and how you came across hyaluronic acid?
Yeah, happy to. Right. So I'm an MD by training. It's interesting. I haven't seen a patient in a long time. I've actually been working in Boston in the human biotech industry. And one thing that I noticed while on the job is that pretty much all the new veterinary drugs are just old human drugs. And the interesting corollary to this is that pretty much all human drugs are tested in dogs first. You're probably familiar with this. They're almost always beagles. And the really frustrating part of this is you could generate really good data out of these studies and nobody does anything with it. And I observed this pattern and I was pretty frustrated. I was thought, how can you have positive outcome, positive readout, design study and not tell veterinarians out there who are practicing and would benefit, their patients and their practices would benefit from this information. I think a recent example of this that people know about is JAK inhibitors. JAK inhibitors, Apoquil is a big one. These were tested in dogs first 20 years ago. And of course, that led to human trials and human approvals. Today, there are 10 JAK inhibitors on the market with many more coming online. And there's only, I think, is the second JAK inhibitor became available last year for veterinarians. Meanwhile, on the human side of things, there's like Super Bowl commercials for these JAK inhibitors. They've all made tens of billions of dollars. And so again, this is an interesting dynamic where tested in dogs first, huge success, ultimately humans, and then boomerangs back. It's really a boomerang back into back into veterinary medicine. I basically said, look, there's probably many examples like this. And I spent the better part of a year reading, hundreds of PubMed articles, FDA filings and things, looking for compounds that fit that same mold. And the outcome was PerioVive, hyaluronic acid. And I think we're going to go into detail on it on the episode here, but it's been studied extensively, certainly in canine studies, but also in human studies. And for whatever reason, there wasn't a veterinary equivalent out there until this point. And so I'm excited to share a lot of that detail with you today.
Excellent. That's some pretty insightful observations that led you to that. That's very impressive. Can you explain exactly how hyaluronic acid works in our applications? What are the basic mechanisms where we can regenerate tissue?
That's right. Hyaluronic acid is just, first of all, it's ubiquitous in all multicellular life. It's an extracellular scaffold is the best way to describe it. Basically, it's like the interstitial stuff, like structure in between cells, right? You could imagine it as a pillar in a building or something. And technically, they're long chains of disaccharide repeats. So just carbon sugars with, if you remember your biochemistry, they have little hydroxyl groups on them and so on. And other cells, epithelial cells, fibroblasts, whatever, they attach to these long chains, and then that helps form structure in your tissues, right? Now, where it specifically relates to medicine is anytime you have trauma or disorder or pathology in your tissues, hyaluronic acid is generated in high amounts to try to organize that setting. And so just as an example, let's say you get a cut on your skin, right? Now your epithelium is disrupted, the connective tissue is disrupted, right? And what happens is clot forms, right? Platelets come in, fibrinogen's activated, and so on and so forth. As part of that process, hyaluronic acid is also generated in high amounts, right? It's already there, but now you need more of it to hold the thing together. It's like a glue that holds the clot together, holds the tissue together. And from that perspective, while it itself is just, again, it's just like this glue, right? It has all of these interesting knock-on effects by enhancing the function of the endogenous machinery, or your basically your body's cells, right? At the highest level, or at the first thing, is it holds the clot together, which is important, right? You ideally have a nice stable clot. Additionally, it drives vascular growth to the site, so you have more blood vessels and such, delivering nutrients and sending white cells in that direction, and so on. And then provides a scaffold. Imagine the framework of a house, and you have all these builders coming in, laying down bricks and building around the scaffold. That's what it's doing from the perspective of osteoblasts and chondrocytes and fibroblasts, building up that connective tissue, building up the bone, and so on. That's the detailed mechanism for hyaluronic acid. And it's been studied in all kinds of settings, right? I just mentioned wounds, right? It does the same function in joints, right? The very first approval was for equine osteoarthritis. So, you have a joint capsule, you got a lot of inflammation in there, you got disordered tissue. You can inject hyaluronic acid and it'll improve the joint function, and in much the same way that I described, maybe with a more chondrocyte cartilage focus. And then finally, as it pertains to us, we're on the Vet Dental Show, it is shown to do the same thing in gums and teeth, and maybe no surprise, right? I think people use HA all the time in their practices already. Adequate is HA, Optics Care is HA. People know about it. It's the active ingredient in a lot of moisturizers. And yeah, it's no surprise that it also works in gums and teeth. And it's been studied extensively in human medicine. But again, this is the first time that it's coming to market in terms of the veterinary dental side of things.
Excellent explanation. I think everybody will get a really good idea about how that works from the mechanism standpoint. Maybe let's look at our main indication, in my view, of using PerioVive, which again is a gel. To clarify, Brian is the founder and CEO of PerioVive, and the gel applicator makes it super easy to apply to our pathology in the oral cavity. And the main indication that I see for general practice specifically is periodontal pockets. So if we're looking at our periodontal patients and we have our periodontal pro and we're evaluating that patient from a charting standpoint and looking at pocket depth, but more importantly, does that probe induce bleeding when we place it in the pocket gently, although firmly, but gently, if you will. And if it does induce bleeding, we've got an abnormal pocket that needs to be curetted from a soft tissue standpoint, and the root needs to be cleaned using root planing, both of which are provided by a periodontal curette. So the instrumentation for that application is just that. The procedure itself can be learned fairly readily just by drawing on your experience with treating periodontal pockets with doxyrobe in the past, which we'll talk about here in a little while. But for that indication, Brian, after that pocket's cleaned with subgingival curettage and root planing, what are the specific mechanisms that will induce what our ultimate goal is, to create a new attachment, making that, let's say, 5 millimeter pocket now a abnormal pocket, now a 2 or 3 millimeter normal pocket?
Yeah, thanks. Thanks for that, Brett. I want to emphasize something that you mentioned, right? This is not a replacement for good subgingival cleaning, a curettage, right? You need to get in there and remove the plaque, remove the necrotic tissue, and then have that sort of reset. Because if this was a replacement for regular dentistry, then we wouldn't go to the dentist, right? We would just be using hyaluronic acid. Now, that's not to say that your periodontist is not using HA or your dentist is not using HA as an adjunct to their procedure, but it is to say that you should still do the cohat. And then it's at the end that you apply it exactly as you say. And then, yeah, as far as the application itself, it comes with a blunt tipped applicator tip, and you literally just squirt it into the pocket. And as far as the mechanisms and things, it's more or less the same mechanisms that I described earlier. You really can think of, and this is more your domain, your expertise, Brett, is you really can think of periodontal disease as just one big wound, one big chronic wound, right? And it is a chronic wound. And so what happens when you're debriding it is you're resetting it back into an acute wound. And that opportunity, or that gives that pocket the opportunity to hopefully reset and then heal back, because up to that point, it's just been a festering chronic wound for many months, maybe years. Now, in that small window of opportunity where it's an acute wound and it can grow back as much as it can, you're putting in hyaluronic acid and then accelerating that growth or maximizing that growth. And studies have shown that you're doubling the efficacy or the tissue regeneration that you otherwise get with just curettage alone, right? And that's been measured across multiple important endpoints: bone regeneration, ligament attachment, cementum formation, all the things that you want to see as far as tissue regeneration, right? And yeah, the final thing to say is, like, they will need to come back for another cleaning, right? It's not a cure by any means. Again, or otherwise we would never go to the dentist. Or maybe some of us need to go more than others. But yeah, what you're basically doing is you're improving that tissue regeneration, giving it as much of a boost as you can, such that when they come back in a year later, hopefully it hasn't progressed now to the point where you have to extract, right? Instead, it's either the same or maybe it's even slightly improved. And that's where you can save more teeth. And that's where the most exciting application is. It's when you have these borderline pockets, they're, call it 4 millimeters depth, 5 millimeters depth, 30% bone loss. You have the chance to save these now instead of automatically extracting, which maybe you weren't comfortable trying to hold on to in previous procedures.
Excellent. And I just want to get a little deeper in the pocket and talk about the mechanism for the body's ability negatively to impact that pocket after it's cleaned. So when we're looking at doing our subgingival curettage and our root planing, the subgingival curettage is the removal of granulation tissue in the pocket itself, not only in the wall of the pocket, but also the base of the pocket. So all of that tissue is abnormal, inflamed tissue, and we're debriding it to the point where we are down to nice, normal connective tissue underneath all that abnormal tissue. The body, unfortunately, wants to recreate what we call a long junctional epithelium, which is where the gum tissue at that margin where we're placing that probe, the normal gum tissue tries to migrate down into that tissue that we just cleaned off, that's now connective tissue, and go all the way to the base to form what we call long junctional epithelium. Unfortunately, that's not what we want. What we want is to inhibit that epithelium from coming into the defect, and in so doing, allow reattachment or new attachment to the substrate in order to minimize the pocket. If you have a 5 millimeter pocket and the long junctional epithelium is allowed to come in there and heal over that connective tissue, then you've still got a 5 millimeter pocket. So we want to eliminate that. And PerioVive hyaluronic acid in general provides a mechanism whereby that can occur. So maybe go into how that inhibits epithelial downgrowth, not only in our periodontal pockets, but also in our infrabony pockets where we're trying to grow new bone and new attachment to save a tooth that's a little further progressed than just a pocket.
Yeah. So without going into all of the gobbledygook of alphabet soup, there's all these receptors and proteases, and so on and so forth. Again, you can think of it like a framework to your house, right? It's a nice scaffolding function that provides structure and organization to your different builder cells. And what you're describing, Brett, is when there's chaotic or disordered regrowth in the context of a periodontal pocket wound, right? And when you add hyaluronic acid into the mix, it helps these cells orient themselves in the proper space and then build in the correct directions and so on. And so this has been confirmed by histopathology. Basically, they took tissue samples, put them under a microscope, and then confirmed with microscopic precision that not only were getting the amount of bone regeneration and ligament attachment and so on that you were looking for, but it was also in the right orientation. It was healthy ligament attachment. Another way that you could describe it, Brett, is you want the ligament attachment to be perpendicular to the tooth, right? You want it to be attaching perpendicularly, holding it in the spot, right? It doesn't help you if it's not orderly in perpendicular lines like this. If it's some lines are going this way, or worst of all, it's parallel, right? That ligament isn't doing you any good. And exactly as you described. And so hyaluronic acid provides that structure, those sort of instructions to all of these builder cells coming in, again, to making sure that everything that comes in is orderly and healthy, versus even in the context of you're doing your best job, sometimes it can grow back disorderly. And, you obviously don't want that.
Absolutely. Let me add one thing to that might be a phrase that you guys have heard before with trying to use bone grafts for periodontal defects. And that is, it acts as a membrane, not only in the periodontal pocket that we're talking about, but also over a bone graft or incorporated into a bone graft. And so it is a physical space occupier. So its gel-like structure binds with the blood clot bone combination in a bone graft and allows for that membrane effect, just as if you were putting a collagen membrane over the bone graft to prevent that epithelium from coming down in. So it's exactly the same mechanism. And we've used Doxyrobe for that, because Doxyrobe's characteristics were that if you place it in the pocket, it's going to set up with cooling, with air water. And so it actually is a physical membrane that you put over these bone grafts. And we've, for years, many years, decades, have used it not only in veterinary medicine, but also in human medicine for the exact same effect, to decrease that epithelial downgrowth in our periodontal pockets after root planing and curettage. To get a little bit more granular with it, that's how I look at it. And I think that's how it's an easy way to think about it. You're just putting something in there that's preventing that normal tissue that's bad in our situation from coming in and resulting in an unsuccessful outcome to your procedure. I hope you enjoyed that episode. Thanks to Brian for being here and making that happen. You can obtain PerioVive on drbrettspets.com, and I would strongly suggest that you consider incorporating root planing, curettage, if not bone grafting and utilization of hyaluronic acid in the form of PerioVive in your practice. So drbrettspets.com. Hope you enjoyed this episode, and we'll see you next week.